Can go ahead and get started. Hi, everyone, and welcome to running a non-invasive ventilation scenario with the RespiSim system presented by IngMar Medical. Just a note that by registering for and viewing today's virtual learning lab, you agree to receive follow-up communication via email from representatives with IngMar. This session is being recorded and will be uploaded to the online learning section of the SSH website later this evening. If this is your first time tuning into a virtual learning lab, note that these weekly sessions are hosted by members of the SSH Corporate Roundtable every Wednesday at 2 p.m. Eastern. I will now turn the session over to IngMar to get started.
Thank you so much, and welcome everyone to our learning lab today on running a non-invasive ventilation scenario with the RespiSim system. Just a couple quick notes here. Justina and myself do have masks on because we're indoors and in the same room. So we're trying to speak loudly and enunciate, but at any time if you can't hear us, you need us to repeat something, or there's any issues with audio or what we're sharing, please do jump into the chat function of Zoom, as most of you already are, and let us know. Any questions you can also put into that session. So today, my name is Liz Bolin. I'm one of your hosts. I am the Business Development and Brand Manager here at IngMar Medical. And to tell you just a bit about myself, I have a varied background in sales and marketing within the healthcare industry. I've sold medical supplies like catheters and ostomy bags, and I've even sold exam preparation software for medical students and residents. I've been with IngMar Medical for about 3 years now. I actually struggle with asthma myself, so I can say now, working here for 3 years, I have a lot of knowledge about the lungs, and I have a whole new level of respect and appreciation for those of you who teach others about respiratory and care for people with respiratory conditions as well. So thank you to all of you on the call and welcome. We also have Justina Gerard here, and I will let her introduce herself.
Hello everyone, my name is Justina Gerard. I am the product manager here at IngMar Medical. By profession, I am a respiratory therapist. I've been practicing for approximately 10 years, and my experience ranges from neonatal the whole way up to the adult realm. I've been at IngMar Medical for approximately 2 years, and the experiences I've gained with simulation has been absolutely amazing. Being able to travel across the country to educate, talk with medical professionals, and to honestly see how different facilities manage their simulation programs has been an amazing experience. So I am super excited to be here with everybody today, and let's get started.
Yeah, and just so you know, I just shared hello. We are live in our own virtual training lab here today. We will get started with mainly some slides, but we do have some videos, and we will be doing some live video sharing as well. So just wanted to say hello. All right, so next up, we will review our agenda. All right. So on the agenda today, we are going to start off with just a quick introduction of IngMar Medical, who we are, what we stand for, what our mission and our vision is. Then we'll go into some types of learning. So the 3 types of learning we want to focus on, and specifically blended learning, which is our focus for today. A lot of you already mentioned in the chat that you're wanting to know, how can I accomplish some virtual training and keep simulation going, but virtually? So we will do that. And then we will also watch a live simulation. So we have a non-invasive scenario to run today, and we will be able to watch that live, so you can use that as some inspiration for a simulation you might want to run. It'll be great for interdisciplinary, so not just for respiratory therapists, but nursing, EMS as well. And we'll wrap up this session just learning about the technology that we used to create the simulation, and talk a little bit about the next generation of RespiSim software that IngMar Medical is going to release here in the next couple of weeks. So again, everyone's audio is muted. Any questions, comments, please do use that Zoom chat function. We are keeping an eye on that to say hello back and answer any of your questions. All right, so first up is our brief intro of IngMar Medical. So IngMar Medical was founded in 1993, and we are headquartered in Pittsburgh, PA. And we are the global leader in respiratory simulation. And we provide those lung simulation solutions to three main markets, those being researchers, educators, and engineers. Our mission at IngMar Medical is to decrease the suffering and improve the outcomes for any person who is supported by or needs respiratory treatments or devices. Now, for that engineer and researcher market, we do that by helping them with their device development and testing. So ventilators, for example. And for the educator sector, we aim to accomplish our mission by providing tools that educators can use to create competence by combining knowledge and hands-on training. Our vision for the future is that we are going to play an integral role in helping simulation become the worldwide standard for mechanical ventilation training. Now, a little bit more on that topic. As I just said, our vision is to play an integral role in helping simulation become the worldwide standard for mechanical ventilation training. So a short point about that, if you think about you want to learn how to scuba dive, or you want to learn how to provide CPR, there are standards for that training that you follow that are pretty accepted worldwide. And once you get done with those standards, then you're able to perform that task. However, mechanical ventilation is a little different because right now we don't have any standards. So this is just an extra point about IngMar really wanting to help simulation become one of those standards for the training, particularly with the ventilator interactions and unparalleled realism. We also aim to raise the level of competency in ventilation for a wide range of clinicians. We at IngMar Medical stand by and support the respiratory therapist profession. We have 3 RTs on staff here to help us, and we want to advocate for recruiting more specialists into the respiratory therapy field. We want to provide resources for the RTs, and we also want to encourage funding into that field as well. However, we also want to enable other clinicians at the same time to better assist RTs through a more thorough understanding of the basics of mechanical ventilation. Now, Justina, you had just had some experience in New York around this topic about enabling other clinicians versus really focusing on the RTs. Will you share what you experienced there?
Yes, definitely. So as an RT, you know, our background always says pro RT, don't teach other people how to use our equipment. You know, please keep your fingers off of our ventilator. So that's kind of been my mindset for the majority of my career. However, after going to New York and speaking with some clinicians who were in the epicenter of the COVID crisis, I kind of realized the importance of making other people aware of how to use the ventilators that we have. And I'm not saying completely be able to diagnose everything that goes on with them, but as they told me, each therapist was running up to 30+ ventilators themselves. And these are critically ill patients. And when you have 200 ventilated patients in each hospital, it makes it very difficult for an RT to be responsible for all of those vents. Now, something simple like a high peak pressure or, you know, maybe even a circuit disconnect that somebody else could realize, like the OB doctors who were on the floor trying to help the ventilated patients, just giving them some background would really help our patient care. So we're taking a step back on it being about us as clinicians and taking a step forward and making it about our patients and the patient care that we provide. So as an RT, I am totally for educating people on the basics of mechanical ventilation with the understanding we will not be able to teach them everything that we know as a respiratory therapist. However, it's for our patients. And that's one thing that I had a real big takeaway from speaking with these clinicians in New York. And I think it's something really important for all of us to think about is we're in this together. We're a giant team of healthcare professionals. And it's really important for us to share our knowledge with each other. And simulation is the best way to be able to do that because we're not harming any patients at that point in time. So
Back to you, Liz. Thank you so much, Justina. Next up, we hope to expand our educational services here at IngMar to increase utilization for the simulation equipment that people invest in for their ventilation training. So as I mentioned, we have 3 RTs on staff, and we are working very hard to create time for consultation hours, time for additional trainings, sessions such as these, and more resources. As we all know, simulations can be a lot of work, and we know that educators are already strapped for time. So we just want to better support educators who want to create and run simulations. Lastly here, and most recently, we're obviously looking to adapt to the current climate by offering remote training and e-learning tools. And hopefully with this session, you'll be able to be inspired about how you can possibly still do some of your simulations virtually. And this will be a large part of what we discuss today as we look at the types of learning and how we can adjust and adapt to still use simulation in this newly virtual world. So really quickly, I'm going to review just the basic advantages of patient simulation. I'm sure we're all aware of how effective and advantageous patient simulation is, but there may be some things on here you've never thought of. So when you're advocating throughout your own organization on why we should be spending time trying to go virtual with our simulation, here's some things you can bring up. Now, we believe that patient simulation can be the best course of action to try and standardize and improve your ventilation training. One of the reasons is that we aren't now depending on encountering real patients for your training. If you don't want to depend on one learner getting a patient in a clinical round and the other one not having that experience. So simulation allows us to create structured and repeatable simulations, which then allows for that deliberate practice, which is really what makes the big difference. So instead of 3 different students getting trained and tested on 3 different patients or just hoping to encounter them in the clinical rounds, we can now use simulation to train and test all of them on the exact same patient. And we can also tailor our training and simulations to be appropriately challenging for our first years, all the way through those credentialed practitioners who can maybe handle a couple more loops or hoops that they have to jump through. Next up, we also remove the risk of harming patients. So through simulation, the student can learn through hands-on experience. Now this may seem like an obvious part, is no risk to the patients, but I think one of the most important parts here is that we want to allow them the room and the comfort to make a mistake, because those mistakes can be really powerful teaching moments, and simulation allows us to make mistakes without harming a real patient. Next up, as we touched on a little bit, simulation opens up the opportunity to train on those low frequency, high risk patients. So for example, with simulation, we can train on recognizing and treating attention pneumothorax. Now that is a high urgency situation, but something that you may never encounter on a real patient during your clinical rounds. And lastly, ventilation simulation is an excellent opportunity for practicing teamwork and the art, because it's truly an art, of effective communication. So for example, the best approach to successfully wean a patient off of a ventilator does require that teamwork approach. And you want all of the people involved, like the RTs, the nurses, the physicians, the PTs, any other clinicians, to all be speaking the same language. And before we move on, I just wanted to share this quote that I found interesting, because at the same time, it's important to understand what exactly simulation can do and what it can't do. So let's keep our expectations here. The main objective for simulation is not to remove all of the fear and anxiety around clinical situations, but at least to drastically reduce that and build their confidence. So this quote here says, simulation of the operating room environment before the internship cannot reduce the operating room students' situational anxiety on the first day of internship, but it absolutely can reduce their situational anxiety during the internship and significantly reduce it at the end of the internship compared to those who are not in the simulated environment. So we want to understand that simulation is there to drastically reduce the anxiety and build the confidence in their practice, and you're promoting the psychological health of the clinicians that are expected to provide this best care. It's a lot of pressure on people. So to just give them some simulation time to build their confidence and reduce that anxiety. That's exactly what we want to use simulation for. Moving on, we're now going to go into the 3 types of learning that we had discussed on the agenda. And then we'll narrow our focus to how we can foster effective training virtually. So the first type of learning that you see listed here is e-learning. And this is typically a self-study type of learning in which the learner is taking online courses to build the foundational knowledge that they need before being exposed to those clinical scenarios. Now, this type of learning is not going to be the focus of today's session, but I do want to mention that we have some materials created already that you could use as an educator for this type of learning. Now, we'll send the link in the chat here, but we have an excellent webinar on safe mechanical ventilation. We also have webinars showing hands-on simulations, such as the one you'll see today. And we also have a webpage full of external resources to help clinicians understand the proper use of most major ventilators. In addition to the resources we already have, we're also working very hard internally here on creating our own learning management system to provide courses such as Respiratory 101, which will really allow for that virtual individual e-learning. The next type of learning is our focus for today, which is blended learning. And it sounded like a lot of you on the chat were doing a little bit of experiential learning and a little bit of blended learning. So blended learning takes advantage of virtual simulations. While we're not able to maybe all be in the simulation room together, we can still take advantage of the technology we have available to us today and provide training via simulation virtually. This is a sweet spot of learning too, because it can be used by respiratory therapists and respiratory physicians to demonstrate ventilation concepts from basic all the way to advanced. But it can also be used by those other disciplines that we were talking about, nursing, EMS, and teach the basics of ventilation. Now, blended learning, like I said, is our main focus for today, and we will have more information on that coming up next. But lastly, let's just review the 3rd type of learning, which a couple of you were very smartly doing in a safe way. It's the experiential learning. Now, this is the type of learning that IngMar Medical stands by as one of the most effective methods of training. That is immersive hands-on simulations using real equipment, like the real ventilators, with or without the instructor. And while this type of learning is ideal for the highest level of competency and confidence, like some of us already know, we may not be able to accomplish this as we'd hoped in our current situation. So again, our focus for today will be accomplishing that virtual training.
All right, thank you, Liz. So I'm going to talk a little bit further about what this blending learning is. So blended learning takes our personal courses that we can do, maybe like e-learning. It also incorporates some small group instruction. And then we have a collaborative portion of blended learning. And then finally, we have individual learning. So that depiction on the right is kind of the whole encompassing idea of blending learning. And I'm going to talk a little bit further about that. So due to our current restrictions around social distancing, all of us, you guys included, since we saw in the chat, have become very intuitive with the way that they are looking to help their students learn. So we know that hands-on learning in a realistic environment is the best way to allow our learners to achieve the most growth and experience to take with them in their future careers. But how do we make this happen in this virtual environment now? So we can take the technology that we currently have and we can adapt it in ways to make our learners be able to gain and retain knowledge. So ideally, we still want to be able to teach the same concepts that we would be doing in real life and in our simulation center, but we want to do this in a safe environment. This way, all of our learners are still going to get that realistic experience, or as realistic as possible, and we're still going to be maintaining our good social distancing practices. One thing we want to consider when attempting to maintain good simulation practices throughout all of our simulations. So we want to make sure that we're still trying to keep everything as consistent as possible from learner to learner and maintain as many of those good practices that we have all learned and became very familiar with already, taking it into the virtual environment. Another important thing to do with our learners in the virtual environment, which is sometimes really hard for us to get used to doing, but trying to involve the learner in every aspect of the simulation as possible. So when your learner is actually in the simulation center, they would physically be doing things, whether it be touching the mannequin, adjusting the ventilator, suctioning your patient. We want to make sure that the learner is as involved as they would be, like they would be standing in the simulation center. So that might be the learner saying, hey, I think I need you to adjust this on the ventilator. Go ahead and try taking that respiratory rate down. Or as an instructor, relaying back to the, relaying back to the learner, what do you think we should do now? So making sure that even though we are in this virtual environment, that we are involving our learners just the same way as we would in the simulation center. So this we can do via online learning, and this will allow our learners to join into groups. So just like we're doing today on Zoom, we can interact via a chat, or ideally, if it was with my learners, I would prefer to have everybody unmuted. I would prefer to have everybody's video on, so I'm seeing my learners and they're seeing me. So after all of our virtual training has been completed, the ideal situation to get that hands-on experience would still be to bring our students into our simulation center and do either one-on-one simulations or very small groups. Now, according to the chat that I saw, this is exactly what everyone's doing. And when I was in New York, this is exactly how we handled the situation in our simulation center. So everybody wore their masks. If we were within 6 feet of each other, we made sure we had face shields on, we used gloves, you know, maintaining those practices that maybe going back, we should have maintained some of these practices in the first place, and then making sure that we're like super clean and not spreading anything to anybody else. And with the control rooms in your sim centers, actually your instructor really doesn't even need to be in the actual simulation room already. So we already have a few things built into some of our sim centers to allow us to socially distance. Going a little bit further, I'd like to explain how IngMar has created this, what we call virtual training room. So we've always done on-site and live distance training. So we have always had what we consider more of a blended learning here at IngMar. But being that we can't travel on site as much as we would like to, we decided to start looking at different ways that we could utilize the tools that we currently have to make this on-site type of simulation training occur. So one of the biggest requirements for us was to have a platform that we could allow collaboration with. Again, I just spoke about Zoom, but there are a handful of platforms out there that you could use. Zoom just typically tends to be the easiest for us to use. I can see my learner can see me, I can share screens. That's the reason why we choose Zoom, but we know that there are a handful of different platforms, and any of the equipment that I'm mentioning today, or platforms, software or hardware, we do not endorse any specific brand. These are just brands that have been easy for us to use. The next thing we did was we took our current equipment that we had and we added a large camera. So we're using an Amcrest camera, and this camera connects to the internet. So that screen that Liz had showed you at the very beginning with us waving, that was actually streamed via internet browser. So then we could just share that screen and then you can see everything that's occurring in our simulation room. So that camera, and I'll show you in a few minutes how it works, but it allows you to move from side to side in the room and zoom in and out. So I can get very close to a ventilator and show very detailed ventilator interactions. And then I can have my student go ahead and make adjustments or say, hey, can you adjust the PEEP? Can you adjust the respiratory rate? And they can actually see what is occurring to those waveforms. Very similar to what they would see when they are on site or in a clinical environment, but now they're just seeing how the waveforms interact with changes, not physically doing it themselves. The next thing that our camera allows us to do is to, show everything that's occurring. So we could take a simulation and we could use it for teaching moments. So we could say, hey, this is the waveform interaction, or hey, look at your patient breathing, or hey, look at the endotracheal tube, is it in the right position? The camera will allow us to do this. Or we could actually have 2 instructors come in and run the simulation and allow our learners to watch what's occurring in the simulation and learn from those simulations. So we know that anytime we watch something occur, we pick up on things that we might not even realize are are happening while we're physically doing the simulation, but the learner's going to say, hey, you guys really didn't communicate all that well. Next time the learner's going to remember to communicate a little better when they're in that situation. If for some reason your simulation center cannot purchase a camera to put up in it, and you still want to be able to see those ventilator interactions, we also have another device called an EpiFan. And what that does is it allows us to screen share our ventilator screen onto our computer, and then we can also share that through Zoom. So same exact thing that we're doing with this PowerPoint presentation, just sharing it, we can share the waveform interactions, and the learner is still then able to go in and say, make this change to the ventilator, and they'll be able to see in real time what those changes do to their patient. The last big thing that we had in our training room is the addition of monitors. So we have 3 monitors in our room. You'll notice that we are actually logged on to Zoom twice. One is for the participant's view. So we always want to see what the learner's seeing. We want to make sure that the screen that they're actually viewing is the appropriate screen that we're intending to show. Sometimes on Zoom, you tend to share the wrong screen. So that one monitor will allow you to see exactly what your learner is seeing. So that will be one of our monitors. Our second monitor is our Amcrast camera. And so we're going to always be able to see what the camera is seeing. And then our third monitor that we have in the room is our extended display of our laptop that we use to run our software on, or the Zoom platform. And what we can do on there is blow up the participants. So if our participants are running video, that's where I would be able to see my participants at. So our 3 monitors kind of give us the well-rounded room to be able to interact with our students almost like they were here with us. Taking that one step further, within Zoom, Zoom meetings allows you to collaborate. So normally in class, you might have little break-off groups. So we could do one type of large instruction, and then in Zoom meetings, you could break off and have 2 or 3 students collaborate with each other and have little mini groups, and then come back as a large group and work together. So these are like really great options that we have to utilize in this virtual environment to make it as in-person, as personable as possible.
All right, so at this moment, we're actually going to change our sharing to give you a little tour of what we all just talked about here with our Amcrast video and our virtual training room. So you should see us again. Hello.
Hello.
So the Amcrast is showing the cameras in the corner over there, and it's showing us in this view, but Justina has actually set up a couple different shots that she had talked about. So Justina, will you take us through the shots and let us know why we would use each one?
Yeah, definitely. So my shot 1 is my room shot. So this is what you're seeing. This is going to give you an overview of everything. And obviously you're able to see me. So that's the important part of the room. So then if I go to shot 2, our shot 2 is going to be concentrating in on our ASL. So you can see the detail there. You're able to actually read ASL 5000 on it. So we could show, and in our case, what we would do is show people how the lights work, or how to turn it off, how to turn it on. Our shot 3 is going to show you our instructor screen. So our instructor screen, as you can see, we can see everything that's on it right now, and this would be what our instructor would see at any time. So I could have a teaching moment and show my, my learners anything that I'm seeing on my instructor's screen. Shot 4, on the other hand, is my patient monitor. So this is going to be a little bit more important for my learners to see. So that's going to give them their heart rate, their blood pressure, their saturation, anything that they would need to actually assess their patient. And then within the patient monitor, you can actually interact with it. So if the student wanted me to make a change on it, I can go ahead and click on it and make that change for them. Shot shot 5 is going to give me a more detailed view of my patient. My patient is not currently breathing right now. It would be a little loud with us having the mics on and all the equipment right now. So we just chose to turn it off for this presentation. But if my student wanted to see respiratory distress, or if they were breathing super quickly, or even the numbers on the endotracheal tube, I do not have it zoomed in far enough, but I could actually turn my endotracheal tube around and they would be able to zoom in close enough to be able to see the numbers to make sure that I was appropriately positioned for my endotracheal tube. And then my last shot is actually on my ventilator. So I kept saying multiple times that we could actually see the ventilator waveforms and what was going on with it. So you can actually view in your screen, it says standby and the number. So you're able to actually see what's on the monitor. And again, this isn't zoomed in as far as it could be zoomed in more, but just to give you an idea of what we can do with a kind of a camera, a full room camera.
Yeah, so in this setup, you can really see how if you are doing fully virtual, or even if you have a small group in with you and you're doing the rest of the group virtual, you really are able to share virtually all the screens that they would need as a learner. They need to look at their patient, they need to look at the vital signs or the patient monitor, and of course they need to look at the ventilator. Now they're not able to actually touch things, but they are kind of able to use us here as their, what I like to say, virtual Vanna Whites. They're kind of telling me, let me see the monitor data on the vent. Okay, cool, let me turn down the rate a little bit. And we as the instructor or whoever is on site will actually make those adjustments. And then the learner will see that happen in real time and the effects of the decisions that they've made. So pretty cool how we're able to accomplish all of this virtually. All right, so now we're going to get into our next portion, which is the actual simulation that we have for you today. Oh, that's what, sorry. We're all still figuring out Zoom. Okie dokie. Now we're good. So up next, let's get into the simulation. So talking about now that we know what the logistics of blended learning is, who exactly can benefit from it, and how we can accomplish that blended learning, let's actually take a look at an example of a simulation run in a virtual learning environment. So our simulation today is a non-invasive ventilation scenario. And we're going to be using our RespiSim system, which is what you saw set up in the room here with us. And we'll explore a little bit further into what the RespiSim is and how it works, just so you can understand how the simulation is working. This current simulation was created using our current software, which is RespiSim 4.0 software. Any current ASL RespiSim user is probably going to be familiar with that. It should look familiar to you in the simulation. But I'd like to ask you to please pay attention to the software that you see in this simulation today, because at the end of the session, we're going to take a look and take a preview at the unreleased next generation of software. So I really want to focus on what exactly you think about the software that we're currently using, the software that's going to be released here in a couple of weeks, and how much difference it is. A little bit of background here on the ASL 5000. The ASL 5000 was initially developed for researchers and engineers. And the software that we currently have is somewhat indicative of that. It looks like a software that an engineering nerd would love. No knock to them, but it is important that now that it is, the ASL 5000 is one of the most important and popular tools for providing realistic ventilation training, that we switch up our software and make sure it's exactly what educators need. And that's exactly what we did with the next generation of software being released in a couple of weeks, called RespiSim 4.0. It was designed by educators for educators. So you'll see a big difference in the software that you see in the simulation and the software that I'm going to have you preview at the end of this. So before we get into the simulation though, I'd like to just take you through a little video here, and it explains how the ASL 5000 works as part of, or I should say as the foundation of the system, the ventilation training system. All right, so here is the ASL 5000, should look familiar to you. We showed you one in the room here, and we're taking an inside look at the ASL 5000. Now, if you're an educator, you might be using some test lungs already to simulate some breaths, using maybe a bag or a bellow, and you have to mechanically change your resistance and compliance. But with the ASL 5000, this is actually an active servo lung. That's what ASL stands for. And that simulates respiratory mechanics via a piston moving inside of a cylinder. And that's what you're seeing going on here. That's what creates the realistic breath patterns that are picked up by the ventilator as indistinguishable from a real patient. And now, as I told you, it was initially developed for researchers and engineers because it is so realistic, but now it is the most popular solution for educators looking to provide realistic ventilation training. So the great thing about the ASL is that you can use your real ventilators with the ASL 5000 and you're simulating those interactions of a patient. The ventilator, it has no idea that this is not a real patient. That's how accurate it is. Now, as the instructor or the educator, you are controlling, sorry, I'm going to back this up just a tiny bit. You are going to control the breaths of the patient as well as their vital signs or assessments through the software, which we will look at here. And it allows you to have limitless adjustments in the software. And here you'll see the ASL just breathing spontaneously, breathing room air. So you can envision the front port of the ASL 5000 as the patient's mouth, and you can see inhaled and exhaled tidal volumes coming from the port of that ASL 5000. So now that we understand how the ASL works, it's a piston-driven system controlled by software, limitless respiratory mechanics, it's inhaling and exhaling tidal volumes out of that front port. Now let's talk about how it all comes together as part of an educational system. As we said, the instructor is actually controlling the respiratory mechanics of the patient, the ASL 5000, as well as the patient monitor, any assessments. And now your learner comes in and they are looking at the patient monitor as well as the real ventilator interactions. So when you want to place your patient, the ASL 5000, on ventilator support, you can simply connect your ventilator's patient circuit directly to that front port, which can be thought of as the patient's mouth. And now your ventilator is supporting the patient, and the patient, the ASL 5000, is providing inhaled and exhaled tidal volumes to your ventilator. And as you can see, that airflow is bidirectional back and forth between the vent and the ASL. Now, as we have a mannequin here today, you can integrate a compatible mannequin into this system and add haptics and create a more comprehensive learning environment. So it works exactly as we just described, but now you just have a mannequin in between the ASL 5000 and your vent. So if I plug my ASL 5000 into my mannequin, you can see my mannequin's just breathing spontaneously, inhaled and exhaled tidal volumes there. And just like we could feel the airflow coming from the ASL port, now that the air is coming through the mannequin's mouth, you can actually feel those exhaled tidal volumes if you place your hand over the mannequin's mouth. But then we can also intubate the mannequin and connect it to our real ventilator. And you'll see that airflow is bidirectional again, from the ventilator to the mannequin to the ASL and back. And a great thing that we will explore today is it's not just great for mechanical ventilation, it's great for non-invasive ventilation as well. So nasal cannula, non-rebreather, BiPAP, CPAP, bag valve mask, in addition to the mechanical ventilation. So hopefully that video, it was a lot of information, but it should help you understand how the ASL 5000 works when you are trying to understand how we ran this simulation that you're about to watch. All right, so up next, we are, like I said, using our RespiSim Pro package, as you see in the picture here. You saw it in our virtual training room as well. As I mentioned before and in the video, you can simply connect your patient circuit directly to the front port of the ASL 5000. That's if you don't have or don't necessarily need a mannequin, because the breaths are, again, coming from our ASL 5000, not the mannequin. They're just being rerouted through the mannequin. So today we will be using the ASL 5000 to produce our ASL 5 or our patient's lung mechanics and breaths. And we have the what we call the instructor view and the learner view. So let me point that out. We have the ASL as the foundation of our system. The instructor view, which is where you as the educator are controlling any changes that need to happen to the patient, good or bad, whether you're changing their breathing pattern or their respiratory mechanics, or whether you're changing their vital signs for the better or for the worse. Lastly is that learner view, and that's the patient chart, which is what your learner will be looking at to look at vital signs. They can request blood gas values, lab results, x-rays, any of the above. So now that you are aware of what we use to create our simulation, let's learn about what the simulation is, and we'll start watching. So the objectives for our simulation today are to perform an appropriate assessment of ventilation in a non-intubated, spontaneously breathing patient. The learner will be expected to appropriately recommend and initiate non-invasive positive pressure ventilation. And finally, they will be required to assess and adequately manage ventilation and oxygenation issues while utilizing that non-invasive positive pressure ventilation.
So next, I spoke before about how we still want to maintain good practices for simulation. So one of our good practices for simulation is to provide our learners with a pre-brief. So our pre-brief is going to encompass any sort of information. Ideally, if they were in the simulation room, it would be orienting them to the sim center or saying what kind of equipment we'll be using. So for our simulation, since it's virtual, there are some things that you also want to include to your learners now. So maybe how to use Zoom, or how they're going to communicate things with us, or what are they allowed to do during the simulation and not. If this is just a purely watching simulation where they're going to watch the instructors or another group of students perform the simulation, we might want our learners virtually to be quiet and maybe chat or keep their questions to the very end. But if this is an interactive simulation, then we're going to want them to talk more with us, and they're going to have to coach us through the simulation like they would be doing if they were in the room. So today, our pre-brief is just going to explain what the background of our simulation is. So our simulation includes a respiratory therapist and a nurse. And our patient was admitted through the emergency room via EMS complaining of shortness of breath over the last several days. So our patient's condition worsened overnight, so EMS was called. And now I am the respiratory therapist in the emergency room to assist with the patient's respiratory distress.
All right, let's simulate.
Today, I'll be demonstrating a live scenario using the RespiSim system. To run this scenario, we will be using our non-invasive ventilation curriculum module in our instructor dashboard environment within the RespiSim software. According to our initial settings column, the patient starts out on a 4-liter nasal cannula. Our vital signs indicate the patient is tachycardic, hypertensive, and hypoxic. And our blood gas values indicate the patient is acidotic. At this time, we will introduce the learner to the simulation, and we will present our patient information on their monitor. Our patient is a 67-year-old male who was admitted through the ER for a COPD exacerbation and is stating he has a breathing problem. He has thick yellow sputum and also has an 80-pack per year history of smoking. The learner begins to further assess the patient and at any time can ask for supplemental information such as lung sounds, x-rays, ABGs, and lab results. The learner requests a chest x-ray. As the instructor, we will then make the x-ray appear on their monitor. Upon seeing the X-ray, the learner observes some consolidation in the bases. Next, the learner then requests the vital signs and ABGs. As the instructor, we will make this information appear on their screen. The learner notices the acidosis and hypoxemia. The learner states they will listen to the patient's lung sounds. As the instructor, we will activate this information. The learner listens to the lung sounds and hears wheezing. Now, the learner is expected to make a treatment decision based off of their initial assessment of the patient. As the instructor, we will observe and listen to the learner as they make their treatment decision and, if necessary, change the patient condition as a result of their decision, either for the better or for the worse. The learner decides to put the patient on BiPAP 12/5 at 60% O2. As the instructor, this action prompts us to enable column 5. Our instructor actions explain that with a change in pressure of 7 centimeters of water, the patient is still not ventilating correctly. The ventilator indicates the respiratory rate is still high, the patient is still short of breath, and he is using accessory muscles. In addition, the learner notices that the vital signs and ABGs indicate that the patient is still hypoxic and still slightly acidotic. As the instructor, we will encourage the learner to reassess their decision and try again. The learner decides to increase the IPAP to 15. As the instructor, this action prompts us to enable the optimum setting column. Our instructor actions show that this was the correct decision. The ventilator shows the rate has slightly decreased, therefore his work of breathing has decreased and he is now more comfortable. According to his ABGs, the pH and PaCO2 have normalized with his ventilation, but PaO2 remains low. Our instructor actions show us that the simulation has progressed to 4 hours later. The learner is expected to reassess the patient. The learner sees that according to the vital signs, the SpO2 has slightly decreased. The learner requests new blood gas values and sees that the PaO2 has decreased as well. This information indicates that there is an oxygenation issue with the patient. After this new assessment, the learner decides to increase the PEEP while maintaining ventilation at the same time. This results in an IPAP of 20 and a PEEP of 10. As the instructor, this action prompts us to enable the optimum setting column. Our instructor actions show that this was the correct decision. The ventilator shows the work of breathing has decreased even more, making the patient less tachypnic. Our vital signs monitor now shows the SpO2 increased and the learner sees the PaO2 increased as well. The simulation is now complete and the instructor and the learner can debrief.
All right, I hope that you enjoyed that simulation.
I'll be demonstrating.
So let's now hop into the debrief.
So our debriefs want to be performed after every simulation, no matter what. Within the virtual environment, there are some different ways that we can ask questions, but to still get some feedback from our learners. I talked before about how our learners might notice things during the simulation, especially by watching, that we wouldn't have noticed. So here are a few questions that you could think about asking your learners even from a virtual environment. The bottom two, I think, are the most important for these virtual environments. How does the virtual simulation positively affect your patient care? I think any touch point of education can positively affect our patient care. And then the second one, how did this type of virtual training, was it immersive to you? And I think that that's also important because we do want our simulation training to be as immersive as possible.
Excellent. Thank you, Justina. And to wrap up our session here, I just want to talk about the software that you saw in the simulation and now what we have coming up next in a couple of weeks, which is our brand new software, RespiSim 4.0. So the software used to control the ASL 5000 as part of the RespiSim system, which you saw today, is currently called the RespiSim Software 3.6. But we're excited to share that we are creating the next generation of ventilator management software, which is RespiSim 4.0. And the expected release, like I said, is in a few weeks. But until then, I'd love to show you a quick preview of what's to come. And I'd love to hear your feedback afterwards about what you think as far as 3.6 compared to 4.0.
Ventilated patients are at high risk for serious medical complications. Ventilator-associated pneumonia is the leading cause of death among hospital-acquired infections. According to a study of over 800 mechanically ventilated ICU patients, the hospital mortality rate of the ventilated patients was 32%, while the mortality rate of the patients who developed ventilator-associated pneumonia was 46%. Care of ventilated patients should be a top priority, as this population experiences high levels of mortality and morbidity. And now more than ever, there is a glaring need to support and recruit the number of specialists across the world that are responsible for mastering the art form that is effective ventilation. We at IngMar Medical are passionate advocates for the value of improving patient safety through using simulation. That is why we are proud to provide the next generation solution for ventilator management training, the RespiSim system. This solution combines ease of use with powerful technology, making realistic training easier than ever. No more unrealistic interactions. No more labor-intensive restrictive scenarios. No more complicated, counterintuitive software. We've consulted with respiratory educators across the globe to find out exactly what educators need. And we've created a brand new software built from the ground up, designed by educators for educators. Start simulating immediately by browsing the extensive lung model library with over 80 models, neonatal through adult. Create a nearly infinite number of patient conditions. Adjust the lung model using the widest range of resistance, compliance, effort, rate, and inspiratory time, all from one convenient dashboard. Lung model customization and on-the-fly changes will never slow you down, as your adjustments are reflected immediately. Build your own scenario simulations with confidence as you're prompted to populate information based on the INACSL's standards of best practice for simulation. Make labor-intensive restricted scenario simulation building a distant memory. Reconfigure all lung model parameters and patient physiology together to be activated simultaneously during the simulation. Accommodate an unlimited number of paths for the learner with both positive and negative outcomes. And automate your scenario simulations with triggers such as the amount of time elapsed. Spend more time teaching and less time controlling the software during the scenario simulation. Focus your attention on your learner as they sharpen their critical thinking skills and practice making their treatment decisions. Check off their actions, monitor real-time waveform data, and easily make any necessary on-the-fly changes. After the simulation is complete, enter the full debriefing environment to ensure proficiency and competency while also encouraging adaptive expertise from powerful teaching moments. In the end, RespiSim 4.0 software as part of the RespiSim system will be everything you need to easily provide effective experiential learning that make learners unequivocally competent to provide the best patient outcomes. Stand out as an established organization with cutting-edge simulation technology. Recruit more professionals into the respiratory profession. Impact the next generation of respiratory professionals by providing experiential learning. Improve patient outcomes through hands-on practice.
All right, I hope you enjoyed the preview and what's to come with RespiSim 4.0. I also hope that you learned and were inspired by our virtual training session today and ways that you can use simulation virtually. We have a couple minutes left here, and we'll actually leave the floor open for any feedback and questions at this time. Please email or call us. We're here to help. I sent some resources in the chat for all of the resources discussed on this call today. So check the chat out for any of those, the EpiFan, the AmCrest camera, the webinars that I had talked about, the e-learning courses, that's all in the chat. And please use the chat right now to ask any questions or give us any feedback. I'd love to hear what you thought of what 4.0 looks like compared to the software you saw, our current RespiSim 3.6 software. And I put my personal email in the chat as well. My name is Liz Bolin. It's just lbolin@ingmarmed.com. So you can reach out directly to me with any questions, or we're also very happy to help you have a conversation about how you can start using some of the tips we talked about today to provide simulation training virtually, or even learn more about the ASL 5000. Thank you so much to everyone who attended today, and thank you so much for all the work that you're doing in the field. We hope that everyone remains safe. Thanks for all the hard work that you're doing and being so innovative as educators. We all really appreciate you.
Thank you very much, everyone. I really appreciate the time you took to be here with us today.